There are more than 1.7 million cases of COVID-19 around the
this
world.
Coronavirus pandemic, the death toll in this country surpassing 20,000.
Deaths now in all 50 states. The toll more than 23,000.
Number of confirmed coronavirus cases here in the United States rising past the 500,000 mark.
Another painful weekend in the coronavirus pandemic. The death toll is now more than 22,000 nationwide.
On days and I rise up like the day. I rise unafraid. I rise up and I do it 1,000 times again. And I rise up, I like the waves. I rise up in spite of the ache. I rise up and I do it 1,000 times again.
Thank you, healthcare workers.
Thank you.
Thank you to all the healthcare workers and people on the front lines in this pandemic.
Peace to the healthcare workers. They are heroes. We love them all.
Thank you to all our essential workers. Hope you guys stay safe. Real heroes wear scrubs. Thank you.
I just wanted to thank all the nurses and doctors and people that are contributing to the containing of the coronavirus.
Thank you.
I just wanted to say thank you to all of our healthcare workers out there for working tirelessly long hours and putting your lives at risk every single day to help others. You guys truly are inspiring and incredible people, so thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, healthcare workers.
Thank you so much for everything you guys do. We really appreciate it and we hope you and your family stay safe.
Thank you.
Thank you.
Thank you.
Thank you to all the healthcare workers who are putting their lives on the line to help overcome this tragedy.
Thank you for the healthcare providers who are risking their lives to protect people from COVID-19.
A big thank you to all you essential workers out there. We are indebted to you. Thank you for all you do.
Thank you.
I just want to say thank you to all the essential workers who are putting their lives at risk to help save our lives and to help stop the spread of COVID-19.
Thank you to all the healthcare workers for your courage and commitment to helping and saving others.
Thank you to all the healthcare workers that are risking their lives to help stop the spread of coronavirus.
Thank you.
Thank you, essential workers, for all that you are doing. You're so appreciated.
I will rise 1,000 times again.
Yeah, I know it. Can't take my youth away. Soul in my will never fade. As long as I wake up today, you can't take my youth away. You can't take my youth away. The soul in my will never fade. As long as I wake up today, you can't take my youth away. You can't take my youth away.
Hi, wizards.
Welcome to another episode of BGTV. I know this isn't our normal setup, but we're working with what we have at the moment.
As you may know, the world is on pause. We are living in a pandemic and we are facing uncharted waters.
The coronavirus is an infectious disease caused by a new virus. The symptoms of the virus are flu-like symptoms: coughing, fever, and fatigue.
To prevent the spread of this virus, we all must do our part by staying home, washing our hands, keeping a safe distance from others, and covering our coughs.
As a community, we need to come together by staying apart in order to help this situation.
In addition, we need to do what we do best and be there for each other. For those who have been affected by this virus, we wish you strength and health. You're in our prayers.
To the students and staff of Washingtonville, we will get through this together.
Districts all over the country have begun online learning. This is all new to us, teachers included.
Please give your best effort when completing the work your teacher assigns. If you have any questions or concerns, teachers will have office hours to answer any of your emails.
As for us seniors, although we're missing out on so many milestones and special events, we have to stay strong and positive and believe that this will all be over soon.
Now, Even though this is all happening around us, the show must go on, Wizard Nation.
So we have created a modified version of BGTV that will hopefully bring you all a little bit of joy that we all desperately need.
Now, here's Michael Brockway, who was able to interview a very special essential worker.
Howdy, Wizard Nation. I'm Michael Brockway, and today I'm going to be interviewing my aunt via FaceTime, and she's a medical worker down in Maryland. So, without further ado, let's see what she has to say about what she's been dealing with down there. Well, Aunt Kim, would you like to just give a little introduction of yourself and who you are?
Yeah, thank you so much for having me. So, my name's Kim Levinson. I am a GYN oncologist. I am at Johns Hopkins here in Baltimore, Maryland. I work primarily at one of our sister hospitals called GBMC. We have a Johns Hopkins division there, and I run that division there. So I'm the director of Johns Hopkins GYN Oncology at GBMC.
So before we were in the midst of this global pandemic, what kind of patients were you dealing with at the hospital?
Yeah, so most of my patients are all patients with GYN cancers. So ovarian cancers, uterine cancers, cervical cancers, and vulvar cancers mostly.
So what precautions do you have to take when you're dealing with patients who have the coronavirus, as well as patients who have autoimmune deficiencies like cancer patients?
So it's really challenging, actually, and I think, in medicine all the time, we always talk about risks and benefits of treatment versus no treatment, risks and benefits of surgery versus no surgery. And this setting obviously makes that so much harder to balance those risks and benefits because there's so much more risk to patients undergoing treatments right now than in our usual setting, not only coming to the hospitals and being exposed to, other people and the hospital environment and all of that, but also, as you said, having them be further immunosuppressed and not able to potentially fight off an infection as well as somebody who's not immunosuppressed.
So on a much broader scale, on a nationwide scale, what changes do you think we can see in our medical system after this pandemic?
Here in the U.S., we never thought we'd see that, you couldn't get a simple surgical mask, right? You can see I'm wearing a homemade one. And luckily here in Baltimore, I've been very fortunate that we have had sufficient PPE, and the hospitals have done a really good job of stepping up, the protocols in terms of what we should be doing, both around known COVID positive patients, but really the assumption that everybody's positive.
So you have a wife and 2 kids at home, my 2 little cousins, and what kind of precautions do you have to take when you're dealing with these sick patients who are very infectious and coming home after work?
Yeah, so I think there's 2 parts of that. I think the first thing is kind of how to best protect my family, just being somebody who's coming into work and coming into the hospital every day. And then the second thing, and I think part of what you're asking is, obviously our makeup of family and work and life and school is all different right now too. I did have several nights where I had an exposure to a patient who was known COVID positive, and I stayed in a hotel room during the time of when I thought the risk of transmission was the highest of knowing if I was going to get it. So I did stay in a hotel for several nights to make sure that I wouldn't bring anything home to my family.
So this is the penultimate question, but how long do you think it will be before we can return to normalcy?
I do think that right now we don't have a preventative way to stop a resurge or a second wave of this virus from coming. Then really the main thing is going to be about a vaccine. Getting a vaccine, and we know that that's going to take a significant amount of time. And so I think that we're going to continue to see some element of effect from all of this, probably for a good 18 months to 2 years. And I hate to say that, it sounds really pessimistic, but I'm hopeful that we will get more widespread testing and that we will get some treatments that are more effective for this much sooner than that, which I think will help. But realistically, to go back to what we know as being normal, I think it's going to be quite some time. There's so many people who are doing things for the medical community donating, making these masks. You know, I mean, I've got patients who are making them, and family members who are making them and sending them, and just, you know, showing care and gratitude. People being there for each other, honestly. They're really little things. People going to the grocery store for their neighbors who are older and are afraid to go. Sometimes we don't all see those little things going on every day, but I think those acts of kindness sometimes are the most important, and taking away somebody's fear and those kinds of things can really be some of the biggest and most impactful things.
Well, I think that was a very nice way to end this. So thank you so much, Aunt Kim, for your time. And thank you for everything you're doing. We really appreciate it. With BGTV News, I'm Michael Brockway.
And now a public service announcement with tips on how to stay healthy during quarantine.
Tip number 1. Wash your hands frequently. Washing your hands frequently with soap and water or using a hand sanitizer will kill viruses that are on your hands that you may not know are there. Tip number 2 is to maintain a social distance. When you're out in public or around people, you should try to maintain at least 6 feet distance between yourself and anyone else. If you can, aim for more. Tip number 3. Avoid touching your eyes, mouth, and nose. Your hands touch many surfaces throughout the day. Stay healthy by avoiding the urge to touch your face because who knows if they're contaminated. Tip number 4. Wear masks and gloves in public places. Do your part to protect others around you. If you don't have any of these items, there are tons of ways to improvise. Tip number 5. Please stay home. Do not leave your house unless it is for something essential. This will help to reduce the spread. Stay healthy and stay safe, Wizard Nation.
Now, let's take a look at how Colleen is keeping busy during quarantine.
This is Cooking with Colleen, featuring my dog Warrior. The first step to doing anything is to wash your hands. Today we're going to be making ice cream. The first step was to add rock salt and ice to the outside of the ball.
Good job. Good job, Warrior. Good job, Warrior. You want to eat one? Here.
Here I had to flip it over to put the ingredients on the inside of the ball, where it has a separate section to put all the ingredients for the ice cream. And Warrior got a little too excited.
Good job, Warrior.
So we put half and half sugar and vanilla in. And then we had to roll the ball around to make the ice cream. I think it's safe to say that Warrior liked his ice cream. Then he fell asleep after a lot of hard work.
We saw what Colleen's up to. Now let's see how everyone else is keeping occupied in quarantine.
Hi Wizard Nation, it's Hannah. During my quarantine, I've been getting outside a lot and enjoying nature. I hope everyone's safe and healthy, and stay safe.
During this pandemic break, usually I'll make a smoothie for breakfast, and today I made pancakes.
We are going for our nightly walk around the neighborhood.
Hi, my name is Amanda, and during quarantine I've been baking and reorganizing my room and my closet and everything.
Hi, I'm Sophia, and during this quarantine I've been learning embroidery.
Hey, I'm Anna. During quarantine, I've mostly been watching some Netflix and movies. I've been reading. I've been playing the ukulele. I've been mostly just hanging out with my family and hiking and watching the sunset some days. And I bought some new baby chicks and I dyed my hair, and that's about it.
One violin on 26.2.
Hi, my name is Andrea, and during quarantine, I've been baking and making Ukrainian Easter eggs to keep busy.
Let's turn it over to everyone's favorite, Joe with the Flow, who caught up with one of our very own talented wizards.
Music is a message.
Hello, my friends. Joe here, and today, accompanied by my dog, Truffles, I'm going to introduce to you Connor Bankos. A friend of mine and aspiring musician, Connor has the pleasure of welcoming our ears with wonderful songs of his own design in his newly released album, Never Before Discovered. I'll let him take it away so he could give you the 101 on some of his musical background and the album as a whole.
I've always had a really good ear for music since I was born. My parents always bring up stories about how I would hum music I've heard in perfect tune before I had the ability to speak. So I do feel like I was born with an advantage in music. I decided to pursue a career in music when I started learning about how music works in general, the theory of it, and how to manipulate it to your liking to make songs in the style that you like. And after that, I knew that I wanted to make my own original songs for a living, or at least something similar with the skills that I have. My album, Never Before Discovered, was released just a few days ago, and it features songs in a wide range of genres like rock, pop, jazz fusion, piano, instrumental, country, all of them sound completely different from each other. Not one song on the album sounds the same. I tried to put meaning behind all of my songs. They all have a story to them, whether it's from my own personal life or one that I made up. I wrote all the lyrics, all of the melodies, all of everything in it. Recorded, mixed, all of it. As soon as I finished with the album, and it was uploading to SoundCloud, it was like a huge weight was taken off my shoulders. I was so relieved. It was definitely one of the most time-consuming and challenging things that I've ever worked on in my entire life. I'm really happy with the result of it, and I hope to make more in the future. At the moment, you can find the album on SoundCloud only, but in a couple of days it will be put on the big music services like Spotify, Apple Music, iTunes, Amazon Music, and all the other ones you could think of. I would really appreciate it so much if you all gave it a listen, give me any feedback you had, and share it with all of your friends, family, or whoever you feel would like it. Yeah. Thank you for having me on this interview, Sir Joe with the Flow. I'll catch you later.
Here's how you access his website. Just go to connorbankosmusic.webs.com. Here you can subscribe for live updates, read the musician's bio, and more. Thank you guys for tuning in this week, and I hope you check out Connor Bankos. He worked really hard on this to make a quality album, and I know you're gonna love it. That's it from Truffles and I. Stay safe, and peace and love, everybody. Peace and love, everybody.
Another one of our very own wizards, Matt Martinez, will give us the insight into a very important organization that is changing lives, even during quarantine.
In times of uncertainty and fear, it's good to look at the positive things going on. So I want to share with you something really important in my life, the Garden of Dreams Foundation. I've been involved with this foundation since 2014, and they've changed my life. But not just my life. Over the past 10 years, the Garden of Dreams Foundation has brightened the lives of more than 375,000 children who are facing hard obstacles and give them life-changing opportunities through the partner organizations they work with, like Children's Aid NYC, the Children's Village, Detectives Endowment Association, Hospital for Special Surgery, Make-A-Wish, Wounded Warrior Project, NYU Medical Center, and many, many more. Garden of Dreams has helped so many kids gain confidence and realize what they want to do with their lives. They've given us opportunities to go to amazing concerts, sporting events, the Tony Awards, perform at Radio City Music Hall, and even go to a private prom with a bunch of celebrities. With the state of the world at the moment, it's essential to focus on good things and to help as many people as you can. And you can even do that from the safety of your own home by donating to any local or global charity with a message that you believe in. Anything helps.
Up, high like the wave, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again.
I'll do it 1,000 times again. And we'll rise up like the waves. We'll rise up in spite of the ache. We'll rise up and we'll do it 1,000 times again. Be you, be you.
That's all we have for you this week, Wizards.
Tune in for a new episode every Monday.
Stay safe
and healthy.
See you next week on
BGTV. Bye, Gianna.
Bye.
I know it. Yeah, I know it. Can't take my youth away. The soul of mine will never fade. As long as I wake up today, you can't take my youth away.